Hello, so today we are again continuing our congenital series in which the congenital problem in the children, the muscle or skeletal system which are affected in such congenital diseases we are discussing. So today's our discussion is about clavicle bone. So what happens, sometimes there are two ossification center present in the clavicle, so which if because of any physical problem, mechanical problem, and sometimes because of some vascular pulsation, these two ossification centers unable to fuse, unable to maintain a normal long horizontal bond. So that causes a deformity in the middle of clavicle that is known as pseudoarthrosis of the clavicle. So this is basically the failure of fusion between the medial and the lateral part of the ossification center, the primary ossification center. And reason is supposedly because of the subclavian artery pulsation, so that keep pulsating, and that is why it has not been able to form a full long horizontal bone of clavicle. So it looks like a painless deformity. There is no pain in it. The functions are almost normal in this deformity, and you have to rule out certain other situations like neurofibromatosis can also have such type of similar condition, like the cleidocranial dysplasia can also have such type of problems. The skeletal dysplasia can also have such type of problems. The thing is, it is a congenital problem. You can feel that the cosmetically it is not looking good, but normally the functions are almost normal in most of the cases. The abnormality can be, there could be asymmetry between the two sides, the normal side and the abnormal side. You can feel that there are certain restriction of movement, range of motions are certain, are different from the normal side. As the children are used to grow in age, there is appearance of the thoracic outlet syndrome in such children's. So normally it doesn't go for surgery. It's basically the concern is mostly cosmetic. The functional concern are not much. If the functional concerns are present, then there are options. In younger age, we used to resect the in between fibrous tissue part and all the sclerotic bone. We used to preserve the periosteum, which is present in the children and quite thick in children's, and we put some bone graft there. We approximate with the help of sutures both bones together, and we fix it. If the child is more in the growing age, and then in those cases sometimes we need to fix this part with help of an internal fixation device, some metallic plate, and bone grafting as well. So this is about the pseudoarthrosis of the clavicle, this bone. And for more such videos for different varieties of other health issues, please like and subscribe Life Care for You. Thank you.